not waste time and we will directly start our class. So who want to do first history?
Can I try?
Yes, why not? So this is your history station, and you have in the exam 3 minutes, but here we will just give you 2 minutes to prepare. Once you're ready, let me know that we can start it. I will just read it out. Talk to Mrs. Sally, mother of Oliver, 2-year-old boy with high-grade fever, refusal to feed and vomiting from the last 3 days. Take detailed history and address mother concerns and discuss further management and planning. Your time is up. You can start now if you're ready. Yeah, hello, Dr. Anzar. Have you started? You are mute if you have started. Hello, guys. Am I audible? So we're doing the history, and Anzar volunteered for the history. Are you here, Anzar, or you're not here, disconnected?
Yeah, I'm here.
Okay. Do you still need more time? Because exam point of view, your time is up. You can start now.
Yeah, okay, I'll start now.
Okay, great.
Good afternoon.
Good afternoon.
Am I speaking to Sally, mother of Oliver, 2-year-old child?
Yes, doctor. It's me.
Good afternoon. I am Dr. Ansar, one of the pediatricians in this hospital.
Hi, doctor.
Okay, thank you. Is it the right? I want to speak about Oliver condition today.
Yes, doctor. I'm also very worried, and that's why I brought him here today.
Okay, what can you explain what brought you here? What Oliver is having now?
Yes, doctor, actually, he's having this fever from the last 3 days. It's very high. Like if I record it, it's up to 39. And I tried to give him Calpol and ibuprofen, but this fever is not coming down.
Okay.
Yes.
Okay. I think you are going through a little bit bad condition of your child. I'm sorry about that. Okay. How is he now?
Yeah, doctor, he's like very fussy and he's crying more. And I've noted that especially when he's passing his V, at that time he'll start to arch his back and he start to cry more. Um, and he's not eating and drinking enough also from the last 2 days.
Okay. Is there any vomiting?
Yeah, doctor, he's also vomit after meals over the past few days. I tried to give him small amount, but he still was vomiting.
Okay. Yeah. How much is the fever? You told 39 degree. Is it coming down with paracetamol?
No, doctor, I told you that if I'm trying to give him paracetamol and ibuprofen. So usually, if he develop fever, he will respond very well. But this time, I am struggling, and he's not responding well. The fever is not coming down.
Okay. Did you show it to any hospital? Any doctor
Yeah,
has seen?
doctor, we bring him to the GP, and that's what GP referred us here today. They didn't give any medicine to us.
Okay. Okay. Is there any loose motion or
No, no, he's having no loose motions, doctor.
is he passing urine frequently?
Yes, doctor. I also noted that he's passing like urine, and it's slightly cloudy. I don't know, like he has less nappies, less like from the usual now, but it has a strong smell to it.
Okay. He's taking food and all.
Food? No, doctor. He's not
How
been
is-
eating like usual.
Okay. Is this the first time he is having this kind of fever and symptoms related to urine?
No, doctor, I would say this is the third time. Previously, he was also having, in this last year, he has similar two episodes in which he required, both of time, he required antibiotics. And yeah, and he was having some infection of the way they told us. He was having some bug.
Any test done at that time?
Yes, they do the urine test, and there was also tummy scan was done. But they told that everything is there was a bug on the urine, but the tummy scan was normal, doctor.
Okay. Was there any urine culture at that time and done previously?
Yeah, they told they have some. I remember E. coli, some type of this type of organ thing was there, and then they give antibiotics, and then they arrange the scan, but they were normal.
Any urine culture done previously?
Yes, doctor.
What they told about the bug in the urine? Do you
Yeah, they
remember any?
told it was E. coli
Okay.
both times.
Okay. When was the first episode? Can you remember? When
So
was the first episode?
yeah, doctor, I exactly don't remember, but it was just in the last year. Like this is our third visit now to the hospital. I believe this was almost 6 months back. His first 6 or 8 months back before, like first episode, and then after he took antibiotics, and then and then he admitted with the second episode few months back after that one. And now again he's having same problem.
What treatment was given at that time? Was he admitted or oral antibiotics only given, or oral medicine only?
Yeah, doctor, they admitted him, but they give oral medicine. He was given first time they give him amoxicillin, and the second time they give him trimethoprim. But this was that was a few days course.
Okay. Was he symptomatic? How was he in between? Any other problem in between?
No.
How was his birth? Can you explain how was his birth when he was born? How was his
Yeah.
pregnancy period? Any problem was there? And how was his birth? And
Okay. So, doctor, it was a C-section at the 38 something weeks. And they induced me because they tried, but the normal, but it was failed. And he was fine after birth. There were no concerns, and we were discharged after 2 days.
okay, was he cried immediately? Was there any problem immediately after birth?
No.
How much was his birth weight?
Yeah, doctor,
Birth weight.
I don't remember, but it was something like 7 pounds.
Okay. Is there any? How is he growing?
Sorry, growing.
How is he growing now? How much is his weight now?
Doctor, I think he's like don't have any concerns about around his growth. I think he's otherwise fine in terms of his growth.
And regarding his development, do you feel he is
4 minutes left. Mhm.
comparing to other children in the same group?
Yeah,
Do you
doctor. I
remember?
mean, he started small. Yeah, he's saying some sentences, and I think he's coping like with other children. I have no concerns regarding this area.
Can you tell about your family?
So, doctor, Oliver and his dad, and I have one girl. She's 6 year old, and me lives in the home. No.
Okay.
Sorry, what is your question?
Oh, okay. Oh, yeah. Yeah. Only one child you have.
Yeah, Oliver and her sister.
One sister. How much old he?
Yeah, she's 6 year old, doctor.
What Oliver's father? What is your job? You and your Oliver's father doing?
Yeah, doctor. I mostly stay at the home, and Oliver dad is like working in a private company.
Um, can you tell about your family condition? How is he?
Family condition, like doctor. I didn't get your question.
Your family financial status?
Okay, okay. Doctor, I think we are fine. I think we're not. We manage our expenses. Yeah.
Okay. Okay, thank you for thank you.
There still you have 1 minute and 50 seconds.
Yeah. Thank you, Sally, for the cooperation and regarding I will discuss the things with the consultant, and we will do some tests for Oliver, and I will get back to you after the results. Okay.
Okay, doctor. Thank you. So yeah, so you still have 1 minute in the exam. If you have still
Yeah.
1 minute to examiner will keep quiet. Actually, you can in that time you can think about the differentials, or you can just organize your
Yeah.
history. But I think you can present your findings
Yeah.
or summary.
Okay. Today, I got the opportunity to speak to Sally, mother of Oliver, 2-year-old, person with high-grade fever since last 3 days. Mostly continuous high-grade fever up to 39 degree, not completely relieved with the paracetamol, associated with vomiting, excessive crying, and abdominal pain. Also, increased urination and cloudy urine.
Mm-hmm.
There was past history of a similar episode, two episodes of similar urinary tract infection. An investigation at the time, US ultrasound was normal. It was a simple UTI. According to the mother, she was telling E. coli. It was E. coli. Admitted both the time and given oral medicine only, and improved with that. With the family, normal family, developmentally normal birth history, and developmentally normal child with a normal growth. Family with normal family history. Now, with this symptoms, I would like to think about urinary tract infection, recurrent episodes in this child.
Okay. So what do you think is the cause of the recurrent UTI in this child?
This child needs further investigation, as this
So what
child
is
is getting a
what is your differentials? What do you think are the causes of the recurrent UTI? You can just give your thoughts, like what can be that?
any urinary tract abnormalities.
Mm-hmm. Good.
Then
Anything else? Okay.
nothing.
Okay. So how you will manage? How you will investigate this child now? How you will manage this child?
Initially, I will do the urinary urine routine for urine dipstick for nitrogen, and then
Mm-hmm.
urine culture I will do, and see what organism is causing the urinary tract infection. Then, according to the culture reports, and this child, if the child is the urine culture is showing E. coli, I'll manage with oral amoxiclav.
Hmm.
And if it's other organism, according to the urine culture, I will manage.
Okay. Do you want to
And
admit this child?
yeah, because of the high grade fever is there, I will admit the child.
Mm-hmm.
Yeah.
Any other test you want to do as well because of his fever?
Yeah, high-grade fever, blood investigations. Also, I will do blood investigations.
Yes. So what investigation do you want to tell you? So you have to tell the like in the exam way.
Yes. Pardon?
Tell me in the exam way, like examiner want to what are the blood investigation you want to do?
Blood investigation. Initially, I will do CBC of
Mm-hmm.
this child with uh, inflammatory markers.
Yes.
Then urine routine investigation. Urine dipstick for nitrogen. Then urine culture. Then urea creatinine, as this child is suffering from recurrent episodes of urinary tract infection. Urea and blood urea creatinine.
Yes. Okay.
Then,
Mm-hmm. What are the investigation? Any other investigation that you will plan for this child?
as this is a recurrent episodes of urinary tract infection, I will consider him to refer this child for nephrology consultation
Mm-hmm.
and further investigation according to nephrologist's opinion.
Okay. Okay. And what are the type of the antibiotic did you want to start? Would you wait for culture or you would start some treatment?
Yeah, I will take the urine culture and then start on oral amoxiclav for this child.
Okay. Do you think this child has upper UTI or lower UTI?
This child is having high-grade fever and urinary high-grade fever, excess-trying abdominal pain. This I think this is a upper UTI.
Upper UTI. Okay. Okay.
Yes.
So what are the indication of starting the prophylaxis?
Recurrent urinary tract infection.
Mm-hmm.
Then any urinary tract abnormalities.
Okay.
And
Okay. How you will discharge and follow up this child?
when the fever has come down and the child is symptomatically better, I will discharge the child.
Regarding follow up or advice to parents, what advice you will give to parents in the at discharge and how you will follow them up?
For follow-up, I will ask the child to ask some other parents to follow up.
Yeah, it's all right. So it's difficult to say in the exam, yeah, when you are in exam situation. So yeah, what and any advice coming in your mind?
Nothing.
Okay, all right. So well done, Dr. Anzar. Is this your first attempt, right?
Yeah, yeah.
So I will appreciate your courage to come in front and volunteer for the history. So if this is your first attempt, so well done. There are few points that I want to add. Your history was good and systematic. I like the pattern of your history, but there are a few important things that you missed out, like anything coming in your mind or anybody else's mind. What can be added further, or what questions were important that were not asked. So before I tell you, people can also write in the chat, or if you want to open the mic just for brainstorming, so that we know what are the important questions not to be missed in this history. Okay, if everyone is not busy or not willing to answer, then in the history you explore history presenting complaint very well. I think you not specifically didn't ask about the urine stream. That was important because this is a boy and there can be posterior valve. So maybe it is an important thing. And then also I think that you missed some of the um, systemic review totally, like about the constipation was very important because they're usually coexistent. Sometimes the reason of the recurrent UTI can be constipation. And
Yes.
then systemic history, rash was very important, like skin, the nappy rash. It can also tell you like how frequently the mother is changing the nappy, and how is this due to she's keeping the baby prolonged in the nappy or not. So yeah, and Renel is writing that ask about pneumonia, meningitis to rule out them. Yeah, so systemic review, you totally missed the systemic review. So some of the systemic review was very important, relevant to this case. Like, is there any swelling on the back? So is there any, like, it can be spina bifida there. And if you don't ask, then you don't know. And then also, if is there any tummy swelling specifically, you have to ask, because if it's an atypical UTI, then they can be some, you can feel they can have abdominal distension as well. And then you just ask about any, just touch other systems, like any breathing difficulty, or how um, to exclude other possible differentials. So you can keep other differentials in your mind as well. So UTI is one of them, but you have to exclude other systemic history as well. That was the good thing was that you rule out that it is not the you explored that this is not the first episode and this is the third episode, and you ask about the previous investigation as well. And then in the family history, it was important like to ask about the specifically about the is there family history of any kidney disease or anyone having the vesicule reflux. So if you ask about the kidney disease, then you can have an idea. Just ask specifically about this. Then social history was very important. You explored it, and that was good. In the differentials, it can be, as you say, it can be urinary tract infection. So examiner can ask, okay, you get an idea that this is recurrent, that was good, but why it is? So one of them, it's structural. It is due to the structural problem, like it can be VUR, it can be posterior urethral valve, or it can be PUJ obstruction. So give them differentials. Then it can be constipation, because you have not excluded the constipation, or it can be any other systemic disorder as well. It can be constipation, it can be neglect. This child may be having the nappies for prolonged time and not changed, and then there will be, but the good thing was you excluded about the growth. So all the things in your mind is very important, that possible reason why these children can present with the recurrent UTI. Uh, Constipation is very important, don't miss constipation. But uh, okay, in the management, when examiner asks you, so you tell them what you exactly do in the your real situation, like in the when you are in the hospital, what you do. If this child came to you, then you will admit them. You will
Yes.
see how give some analgesia if they are having fever, and then monitor their fluid balance, because they are not eating, they are refusing to vomit, and then you will review their previous culture report, and according to that you will start the antibiotics, and you will inform your senior as well. And then you will send some blood tests. So they will include the full blood count, the CRP, the blood culture, and you will also do the urine dipstick. As this is less than 3-year child, so you have to send urine microscopy and culture as well. And you also mention to the examiner, as I'm suspecting that this child has systemic features and this is unwell child with high grade fever. I'm suspecting that he is having he will need IV antibiotics. So if this is a systemically unwell child, so I will start them on the IV antibiotic. And you can always consult other departments. You have like microbiology. You can always consult them. You can mention them. If you are struggling, like you can always consult other departments for the choice of antibiotics or the duration of the antibiotics. Especially this is the microbiology that can guide you. And looking at the previous culture report, so you can start the antibiotic of choice for them. And then, yeah, follow up. So follow up was like, if this is a recurrent UTI, then we will discuss it there according to the chart. Yeah, there is one investigation chart. According to that, you have to do. So this is recurrent UTI. You essentially don't have to do the ultrasound KUB in the acute infection, but you can arrange for them in 6 weeks time and DMSA scan. So that I was asking again from you, what is the follow up? Specifically, because you have to arrange them and follow up them and see, and then discharge them on the prophylactic medication. Advise parents to give them enough fluid and do the frequent nappy change, hygiene. If it is an older child, then you can also ask about the history, like if they are doing, even in 2 years, you can ask about if they are doing the bubble bath or how are the clothing they are using. So sometime there can be also a triggering factor. Anyway, well done. So now you can see how what I can tell you is more practice, because I feel that questions should be very ready made in the mind. And I feel that sometimes you're just thinking and stop for a while and think for the next question, and then stop for a while and then think for the next question, because exam is very limited time, and then you don't have the time to think there more. And this you can just improve by practicing more and more. So you have a good systematic like system of history. You know how to take it, but your questions need to be more more automatic, I will say. So it will come with practice.
Okay, ma'am.
Anything you want to say?
No, madam. No, madam.
Okay. So the UTI is very important. It is very, very important. Can come in history, and it can come in communication. So these guidelines are the one that you have to memorize very well. I just added few things, but all of them are from the guideline. There is nothing new that I have written here. We'll just discuss about as you mentioned, about the fever, urinary symptoms, burning, urgency, color. And you can also ask about if there is any blood in the urine, how is the stream of the urine, like flow of the urine, any other abnormality in the genitalia. Maybe you can ask about that, fluid refusal, abdominal distension. You miss about the constipation, swelling of the tummy pain, vomiting. That is important. In the CNS, like general well-being, you ask about this weight loss, any abnormal movement, respiratory, any breathing difficulty, any ear discharge, was any blood pressure check for them ever, any swelling on the back, and any nappy rash. So we discuss about all these points. I will be a bit fast here. Previous admission detail in the past history, you ask it. That was very important. And what were the blood tests? And that was a very good point that you asked specifically what was the what was the culture report. Do they remember what was the culture report? And then you can also ask when you were discharged home, did they give you some prophylactic antibiotic or not? So what tests were done, any medication advice, and maybe in this child, is this child circumcised or any, or it was suggested or not? Because if it's a recurrent UTI, so sometimes circumcision is also an indication in that case.